Welcome back to Wally's Nursing Videos, where we dive into essential nursing concepts to help you excel in your practice and patient care. I'm Wally, and today we're tackling a critical topic in cardiovascular health that you won't want to miss. We'll be exploring the connections between four major conditions: hyperlipidemia, atherosclerosis, hypertension, and peripheral arterial disease. Understanding these conditions and their interrelationships is key to providing excellent patient care and effective management strategies. In this video, we'll break down the pathophysiology of each condition, connect the dots between them, and discuss practical nursing interventions, lifestyle modifications, and medications that make a real difference. Whether you're a nursing student or a seasoned nurse, this comprehensive guide will give you the tools you need to enhance your knowledge and improve patient outcomes. So, grab a notebook, get comfortable, and let's dive into the world of cardiovascular health together. If you haven't already, don't forget to hit that subscribe button and ring the bell for more nursing insights. Let's get started. 1. Pathophysiology of the disorders. Hyperlipidemia, HLD. Definition: hyperlipidemia refers to elevated levels of lipids, cholesterol, and triglycerides in the blood. Primary causes: genetic factors such as familial hypercholesterolemia. Secondary causes: obesity, high caloric intake, sedentary lifestyle, diabetes, hypothyroidism, nephrotic syndrome, and obstructive liver disease. Consider metabolic syndrome. According to the National Heart, Lung, and Blood Institute, NHLBI, the cluster of metabolic factors involved includes abdominal obesity. This means having a waist circumference of more than 35 inches for women and more than 40 inches for men. An increased waist circumference is the form of obesity most strongly tied to metabolic syndrome. High blood pressure of 130/80 mmHg, millimeters of mercury, or higher. Normal blood pressure is defined as less than 120 mmHg for systolic pressure, the top number, and less than 80 mmHg for diastolic pressure, the bottom number. High blood pressure is strongly tied to obesity. It is often found in people with insulin resistance. Impaired fasting blood glucose. This means a level equal to or greater than 100 mg/dl. High triglyceride levels of more than 150 mg/dl. Triglycerides are a type of fat in the blood. Low HDL, good cholesterol. Less than 40 mg/dl for men and less than 50 mg/dl for women is considered low. Impact: high levels of low-density lipoprotein, LDL cholesterol, and triglycerides contribute to the formation of fatty deposits in arteries. Atherosclerosis. Definition: atherosclerosis is the hardening and narrowing of arteries due to the buildup of fibrofatty lesions in the intimal lining. Pathogenesis: initiated by endothelial injury, leading to cholesterol accumulation and chronic inflammation. Consequences: progressive narrowing of arteries reduces blood flow and can lead to ischemia in tissues and organs. Hypertension, HTN. Definition: hypertension is characterized by persistently elevated blood pressure. Pathogenesis: involves increased systemic vascular resistance due to constriction of blood vessels and increased cardiac output. Consequences: causes damage to arterial walls, exacerbates atherosclerosis, and increases the risk of cardiovascular events. Peripheral Arterial Disease, PAD. Definition: PAD is a condition characterized by reduced blood flow to the limbs due to atherosclerosis in peripheral arteries. Pathogenesis: plaque buildup narrows and hardens arteries, leading to decreased blood supply to the extremities. 2. Connections between the disorders. Hyperlipidemia and atherosclerosis to hypertension. Mechanism: hyperlipidemia accelerates atherosclerosis by increasing cholesterol deposits in arterial walls. Atherosclerosis leads to arterial stiffening and narrowing, which increases systemic vascular resistance and contributes to hypertension. Hypertension to atherosclerosis. Mechanism: chronic high blood pressure causes additional stress on the arterial walls, leading to endothelial injury. This promotes further cholesterol accumulation and progression of atherosclerosis. Hypertension and atherosclerosis to peripheral arterial disease. Mechanism: both hypertension and atherosclerosis contribute to PAD. Hypertension exacerbates arterial damage, while atherosclerosis directly leads to plaque formation in peripheral arteries, reducing blood flow to the limbs. 3. Nursing care and lifestyle modifications. Teaching and lifestyle modifications. Diet. Emphasize a heart-healthy diet low in saturated fats, cholesterol, and high in fiber. Encourage the consumption of fruits, vegetables, whole grains, and lean proteins. Exercise. Promote regular physical activity, such as walking or cycling, which improves cardiovascular health, helps control weight, and reduces blood pressure. Alcohol. Recommend moderation in alcohol consumption. Excessive intake can increase blood pressure and contribute to hyperlipidemia. Smoking. Strongly advise cessation. Smoking exacerbates atherosclerosis, hypertension, and PAD. The risk of coronary artery disease decreases significantly within 1 year of quitting. Nursing care strategies. Monitoring. Regularly check blood lipid levels, blood pressure, and signs of PAD. Education. Provide patient education on the importance of medication adherence, lifestyle changes, and regular checkups. 4. Medications and therapeutic interventions. Antilipemics. Examples: statins, for example atorvastatin, simvastatin, lower LDL cholesterol levels and stabilize plaques. Effect: primarily targets hyperlipidemia by reducing cholesterol synthesis and promoting plaque stabilization. Antihypertensives. Examples: ACE inhibitors, for example lisinopril, beta blockers, for example metoprolol, calcium channel blockers, for example amlodipine. Effect: lower blood pressure, reduce vascular resistance, and prevent damage to arterial walls. Anti-diabetics. Examples: metformin, SGLT2 inhibitors. Effect: manage blood glucose levels, which can help control hyperlipidemia and reduce the risk of cardiovascular complications. Antiplatelet agents. Examples: aspirin, clopidogrel. Effect: prevent platelet aggregation, reducing the risk of thrombosis and subsequent cardiovascular events. 5. Dietary and lifestyle recommendations. Dietary changes. Focus: reduce intake of saturated fats, trans fats, and cholesterol. Increase consumption of fruits, vegetables, whole grains, and lean proteins. Exercise recommendations. Guideline: aim for at least 150 minutes of moderate intensity aerobic exercise per week. Alcohol consumption. Guideline: limit to moderate levels, up to 1 drink per day for women and 2 for men. Smoking. Recommendation: complete cessation is critical to reduce cardiovascular risks. Medications. Antilipemics, statins for cholesterol management. Antihypertensives, to control blood pressure. Anti-diabetics, to manage diabetes and its cardiovascular impacts. Antiplatelet agents, to prevent blood clots. 6. Analyzing diagnostic results. Blood lipid profiles. Interpretation: elevated LDL and triglycerides confirm hyperlipidemia. Reduced HDL is a risk factor. Blood pressure readings. Interpretation: persistent high readings indicate hypertension, which can exacerbate atherosclerosis and PAD. Imaging and functional tests. Interpretation: angiography or ultrasound can show the extent of atherosclerosis and PAD. Ankle brachial index, ABI, assesses the severity of PAD. That wraps up our deep dive into hyperlipidemia, atherosclerosis, hypertension, and peripheral arterial disease. I hope you found this video informative and valuable for your nursing practice. Remember, understanding these conditions and their connections is crucial for effective patient care and management. If you have any questions or need further clarification, drop them in the comments below. I'm here to help. If you enjoyed this video, give it a thumbs up and share it with your fellow nurses. Don't forget to subscribe to Wally's nursing videos for more content that helps you stay on top of your game. Thanks for tuning in, and I'll see you in the next video. Keep up the great work and stay passionate about nursing.